Deputy Keogh, thank you to you as Chair and to the Committee for the invitation to appear before you today. I am joined here by my colleagues, Jerry Hone, National Director of Services and Integration, Rosario Mannion, National Director of People and Change, Pat Smith, National Director of Finance and Corporate Services, Lorna Kavanagh, Service Director with responsibility for separated children, and Diego Gallagher, Senior Solicitor. We are grateful for the opportunity to meet with you today to discuss our work, the progress made and the challenges we continue to face. When we appeared before you in July this year, I highlighted the growth in demand for our services, with a 100% increase in child protection and welfare referrals since the agency was established in 2014. For the first 9 months of this year, up to the end of September 2025, the agency has received 78,588 referrals, an increase of 11% since the same time last year, and we forecast that this number will be in the order of 105,000 by the end of the year. There are 5,866 young people in our foster care and residential care services and 2,972 young people receiving aftercare services. For the academic year 24-25, there were 9,293 referrals to our Tusla Educational Support Service, a 16% increase on the previous academic year. We are proud of the agency's achievement to date and of the positive work our staff continue to do every day with children, families and communities all over Ireland, often in difficult situations and in response to a changing level of need. It is a positive reflection of the work we do that 9 out of 10 young people living in foster care and residential care are engaged in education, that 3 in 4 young people that leave our care and transition to aftercare services are now in education and training, and this has been evidenced in the CSO Frontier Series report. However, as CEO, I want to assure you that we are acutely aware of the challenges we face and the impact of these challenges on the lives of young people in our care or living in the community and in need of our support. These challenges have widely been articulated by me as CEO, my colleagues, regulators and advocacy groups, and have been publicly documented. Our inability to respond to some young people in the way that we would want is of great concern to me, our board and our staff. At the core of this, we are challenged by workforce supply issues, particularly in social work and social care, leading to a number of unallocated cases in our community services and capacity challenges in our residential and special care services. Wider societal issues such as global movement, poverty, homelessness, domestic, sexual and gender-based violence, drugs, criminality and exploitation, and social media continue to significantly impact the lives of children, young people and families and the subsequent demand for our services. Some of these issues have led to an increase in the number of young people with more complex needs, such as disabilities and mental health issues, and those with much more challenging behaviours, particularly young people aged 16 to 18, engaged in substance misuse, criminal activity, or at risk or subject to criminal and sexual exploitation. The requirement to significantly scale our separated children seeking international protection services has placed a significant pressure on the agency. We are responding to a 500% increase in unaccompanied minors coming to Ireland since 2022. This demand is continuing to grow, resulting in significant strain in both property and workforce supply across the country. There are approximately 550 unaccompanied minors currently in care or being accommodated by Tusla. We continue to engage with the Department of Justice in relation to the implementation of the EU Migration Pact, with a particular focus on proposed revised processes for age assessment and the establishment of a representative service for unaccompanied minors. Our workforce supply issues, the availability of registered providers and the capacity within the property market creates a real challenge for us to place all young people in a registered placement. Where a registered placement or placement in statutory, community and voluntary or private care is not available, a special emergency arrangement is required to ensure an immediate place of safety for a young person. On the 16th of November 2025, there were 58 young people from our mainstream services in special emergency arrangements and 105 unaccompanied minors placed in special emergency arrangements. I would like to briefly outline to the committee some of the actions we have taken and are taking to address the challenges I've just been referred to. These have been addressed through our integrated reform programme, currently being implemented across the agency to ensure that children and young people receive the right response from the right professional in the right place at the right time, and that our staff are supported and valued. Over the last 18 months, with the support of our staff, executive board, department colleagues and ministers, we have made significant progress. We are in the final stages of planning for the implementation of a new operating model in our community services. From the 1st of January 2026, there will be a single point of access to Tusla services with a single child record in every Tusla network across Ireland, with multidisciplinary teams in place to respond in a more integrated way to the needs of children and families. This will mean that families or those making a referral will no longer be told they do not meet the threshold for child protection services, but instead they will be allocated to a family support or early intervention team. And if their needs change, they will be responded to by the most appropriate team in a seamless way. This will ensure a most efficient use of resources, but more importantly, that children and families will experience more positive outcomes. From a workforce perspective, our challenge from 2014 to 2023 was the inadequate supply of social work and social care staff graduating from our third level sector, with approximately 220 social work graduates each year. Through the work of our executive management team, led by our Director of People and Change, and with the support of our colleagues in the Department of Children, CORU and UCC, we launched a social work apprenticeship scheme. With the support of the Minister for Children, we've received funding for 36 apprenticeships in 24, 77 in 25 and 100 in 26. This year we have also commenced a work-based learning programme from social care in partnership with MTU with 17 participants. The impact of these efforts is that we now have 1,730 social work staff and 1,524 social care staff employed in the agency, representing the highest staffing levels to date, but we estimate that approximately 400 additional frontline staff are required to meet presenting demand. Importantly, we have also received much needed investment over the last 3 years in our residential service provision, and we are starting to see the impact of that investment with the opening of our first 4 residential centres since 2018, and we're on track to open a further 8 centres across 26. To open such facilities takes 12 to 18 months from point of purchase to opening at a standard that will meet our regulatory requirements. In 2024, we commissioned an external review of special care, and we are working to implement the 30 recommendations of that review. We also welcome the sanctioning of a new special care worker grade by the Department of Children and DEEPR in an effort to increase our special care capacity. In the respect of the use of special emergency arrangements, we have reduced the costs and strengthened the governance and oversight of these arrangements. We continue to make every effort to increase the capacity of registered residential care and to establish registered emergency intake units for unaccompanied minors. When a young person is placed in a special emergency arrangement, every effort is made to move them to a registered setting as soon as possible. Keeping children safe from harm is our key priority. Under Children's First Act, all of society have a role to play in keeping children safe from harm. And while we are focused on our statutory responsibilities, we continue to engage at a senior level with other state agencies to strengthen interagency working, to ensure families are supported and children are safeguarded and protected. We welcome the review of the Childcare Act and the commitment to place interagency cooperation on a statutory basis, and the commitment in the programme for government for whole of government support for the delivery of alternative care services. Further strengthening of interagency working and the support of cross-government departments is pivotal to protecting the most vulnerable children and families and enabling better outcomes for children and young people with more complex needs. I also want to address the recent tragic and significant incidents involving 4 young people known to our services. As CEO, I understand the concerns of the wider public, and I recognise the impact this has had on families, communities and our staff. While I cannot comment on the specifics of these cases, as there are ongoing investigations by Garda Síochána, I can assure you that we are working with Garda Síochána in relation to these investigations, and all of these cases are being reviewed by the National Review Panel. In the context of the timeline of 2 of these cases, the Minister for Children has also initiated a welfare check of all cases closed to child protection and welfare services closed during COVID-19 between the 1st of March 2020 and the 28th of February 2022, and this process has commenced. I believe the work we do is one of the most important roles in the state, and it is a privilege for us to work for this agency. We are extremely proud of our staff that work tirelessly every day in supporting children, families and communities on our behalf. I'd like to thank the committee for your commitment and advocacy for the most vulnerable children and young people, and I look forward to working with you all further over the coming months.